Welcome back, everyone, for another Women's Health webinar series. And we are into part 7, and we're going to be discussing cortisol and the adrenals. And my name is Heaton, and I am the Women's Health Clinical Liaison. So we're going to do a review of anatomy and physiology of the adrenal glands. We're also going to go look at the biosynthesis of cortisol and discuss the functions, signs, and symptoms of high and low cortisol. We're going to discuss a couple of well-known cortisol disorders, and we're going to review the HPA axis, or your stress response. And I'm going to share some nutritional and lifestyle support for stress. So the adrenal glands are two tiny glands that sit on top of your kidneys, and they are triangular shaped. They almost remind me of party hats. And there's two layers. There is the outer layer, which is the adrenal cortex, and the inner layer, which is the adrenal medulla. And here, with this cross section, we can actually see the three zones in the adrenal cortex. The outer zone is your glomerulosa, and the middle zone, which is the fasciculata. And if you notice that it is a larger area, and this is where cortisol is actually manufactured. And so it should be a little larger just to provide us with the cortisol we need when we need it. And then we've got the reticularis, which is the inner zone here. And this is where our hormones are made, mainly the DHEA, testosterone. And here, this is all categorized based on your zones and the hormones that they make, and then the examples of those hormones. And just to go through them, the glomerulosa, the mineralocorticoids are the ones that regulate mineral balance, like aldosterone is made. Cortisol is made in the fasciculata, which are the glucocorticoids. Then you've got the androgens, mainly DHEA, that's made in the reticularis. And then you've got the adrenal medulla, which actually houses the epinephrine and norepinephrine, which are stress hormones that are retrieved for acute stress. So just a quick review of the biochemistry and cortisol production. The main takeaway here is that cholesterol is the backbone of hormone production. And cholesterol is converted to pregnenolone. Pregnenolone is really the mother of all hormones because she can be converted to any hormone that we need in the body, anywhere from progesterone to aldosterone to cortisol and to any of the sex hormones here. We have a pool of cholesterol that the body pulls from to make these vital hormones as we need them. We hear a lot that cholesterol is bad, but that's not necessarily true. A lot of people are just not aware that excess cholesterol could just be due to the body's response to low hormones, or that there's poor conversion of cholesterol into pregnenolone. And in order for you to have proper conversion, your mitochondria, which is your powerhouse of the cells, and the gatekeepers, your enzymes for pregnenolone production, it has to be healthy and functional, as well as having a healthy level of your active thyroid T3 with proper nutrients that serve as cofactors for conversion. And of course, the other end of the spectrum is that statin drugs are given out like candy now because there are certain guidelines where they require cholesterol levels to be as low as it can go. And too low levels of cholesterol will make it very difficult for the body to make the precursor to all the other hormones, which is pregnenolone. So the body struggles to support you and your functioning declines. So hormones that are produced by the adrenal cortex are referred to as corticosteroids, and these are vital to life, just regulating metabolism, and it helps your body to respond to stress. So we need cortisol to live. So the adrenal cortex produces three kinds of steroids. You've got the glucocorticoids, which is cortisol and corticosterone, the mineralocorticoids, aldosterone, and then the androgens, which are mainly your DHEA, your DHEAS. So the adrenal medulla responds to the sympathetic nervous system stimulation, and it secretes hormones in response to immediate stress. So it secretes catecholamines, which are amine structures that are primarily epinephrine and norepinephrine. It does produce a small amount of dopamine for focus and attention. So the majority of the catecholamine that is made in the adrenal medulla is epinephrine at 80%. And the hormones that are secreted and stored in the adrenal medulla are released, of course, in response to that acute stressor. And that's where your heart rate increases, your blood pressure rises, and your blood sugar is up just to get you going. So this is the chemical structure of cortisol. It is, of course, derived from cholesterol, and it is the most powerful glucocorticoid that's produced in the adrenals. Now, it was first isolated from adrenal extracts by an American chemist by the name of Edward Kendall in 1946, and it was recognized by the American physician Philip Hench, who actually discovered its therapeutic use for application, of course, in human disease and medicine, and that was in 1948. So what is cortisol? It is the only hormone in the body that increases with age. So as we age, we tend to get more stressed, which seems so odd because it should be really the other way around. But that's my logic. It's made by the adrenal glands. It is a glucocorticoid. It is derived from cholesterol, and it is regulated by a signaling pathway, which we will discuss shortly. Of course, it is well known as the stress hormone, and the synthetic drug on the market is referred to as hydrocortisone. Cortisol, when it's functioning normally, it plays very important roles in the body, such as it is a powerful anti-inflammatory, it regulates blood sugar, it supports metabolism, it controls body fat, it protects against infections, it improves mood and thoughts, it participates with aldosterone and sodium reabsorption, it promotes good sleep hygiene, it regulates bone turnover rate, regulates the immune system, it supports protein synthesis, and very importantly, it regulates the stress response. So some physiological effects of cortisol. So it promotes gluconeogenesis. It induces the breakdown of glucose or sugar from fat cells in your liver so that you can use it in times of stress. It promotes the breakdown of skeletal muscle protein. Of course, it reduces protein uptake since the whole point is to give you more energy from sugar and glucose in circulation so that it can help your brain to function and stay alive. It enhances lipolysis. So cortisol does promote fat metabolism. So it releases free fatty acids and glycerol for a surge of energy responding to that stressor. And it suppresses the immune system. So in short-term stress, the immune system revs up as an adaptive response to prepare for injury or infection. But in chronic stress, where there's too much wear and tear, and the system breaks down, and there's this ripple effect on our health. And cortisol is ordinarily anti-inflammatory, and it contains the immune response. But chronic elevations can lead to the immune system being resistant and an accumulation of stress hormones and increased production of inflammatory cytokines can further compromise the immune response. So in chronic stress, it does suppress the immune system. So to sum it up, the adrenal cortex produces hormones that regulate sugar balance, salt and fluid balance in the blood, and your sex hormones like DHEA, testosterone, estrogen. Okay, so cortisol is regulated by a signaling mechanism that begins in the brain, and it starts in the hypothalamus. So a stressor triggers the hypothalamus to release CRH, which is corticotropin hormone or factor. And from there, it signals the pituitary gland to produce ACTH, which is adrenocorticotropic hormone. And once that signal hits the adrenal glands will produce cortisol. And cortisol follows a circadian rhythm, which is a normal rise and fall of cortisol throughout the day. And the release of cortisol throughout the day has to follow this rhythm for us to know the difference between night and day so that we are able to get up in the morning, to be able to do the things we need to do during the day, and to be able to calm and relax so that we can actually fall asleep at night. And it also has a negative feedback to where once there is enough cortisol or excessive cortisol that's being produced in the body, there is an inhibitory response to ACTH and CRH. So when the bucket's pretty much full, basically the water's turned off. And here is your normal circadian rhythm. And this is on a salivary test. So the body should normally rise so that you can get up in the morning. You're not groggy. You shouldn't be agitated either in the morning. You should be able to get up normally, easily, wake up, do the things you need to do throughout the day, and it should drop gradually throughout the day just to give you enough cortisol to function, and then it should start to decline towards the evening and be lowest at night so that your body knows that it's time to rest and to get some sleep. Does this woman remind you of anyone, especially right now during the holidays where none of us are stressed out? No, not at all. We're just cruising along. So let's look at some signs and symptoms of high cortisol. You've got weight gain, especially around the middle, and you have a puffy, flushed face. You have mood swings where you're just so unhappy and nobody is happy around you. Increased anxiety, you're tired more, you're not sleeping as well, so this tired but wired feeling. You're going to the bathroom more, you have irregular periods, or you have fertility issues. You're more susceptible to infections. Your blood pressure goes up. You start to have more skin issues like acne. There's a higher risk for bone fractures and osteoporosis. You have muscle aches and pains. You know, your sex drive isn't there like it was, and you're dehydrated, and you have to drink more. Some more signs of high cortisol: confusion, irritability, night sweats. So with night sweats, it's really interesting because low progesterone or even low estrogen levels can create night sweats. So a lot of times when I talk to women who come in, I always kind of dig into their adrenal symptoms and see what's going on and see what kind of stress level, they have right now or at that point, because a lot of times night sweats can be due to too much cortisol. High cortisol also can lead to gut permeability. It can also create conversion issues with your thyroid from your T4 to T3. It will create blood sugar dysregulation, increase cholesterol, increase insulin, create insulin resistance. You'll have more sugar cravings where you just want sugar from morning to night, and thinning skin. So high cortisol can be very inflammatory, and it can be very damaging to your major organ systems, such as your brain and your heart, your digestive system, your nervous system, your immune system. It can increase your blood pressure and create blood sugar dysregulation, which moves you into the direction of diabetes and with all the metabolic problems that come along with that. So it is important to temper the stress hormone for a healthy, functioning body. And here you will find in chronic stress, high cortisol. And in this case, cortisol stays high throughout the day. It starts high, so this person may awaken with agitation, just feeling bad, and stay stressed pretty much throughout the day, and it never settles down at night. So this person may not be resting well. So when a person is not sleeping well at night, the body overcompensates and they shoot up cortisol higher in the morning. And in this case, it just seems like they never seem to be able to come back down to normal. And this is a dangerous state to be in. So Now let's go to low cortisol. So do you feel tired all the time, pooped out, needing coffee, needing sugar, needing more carbs to keep going? So here are some low cortisol symptoms like low energy, fatigue, low libido. You got to have more caffeine to get through the day. You're anxious and depressed, and you may find yourself with some salt cravings. So when we have adrenal insufficiency, your body makes more aldosterone, which is a mineral corticoid that regulates your body's minerals, electrolytes, and fluid levels. And aldosterone's role is to help the body retain sodium and excrete potassium. So in chronic stress, underproduction of aldosterone leads to low blood pressure, dehydration, and salt cravings. And wherever sodium goes, water follows. And that's probably why you would feel a little lightheaded or dizzy as well due to the low blood pressure. So some more symptoms of low cortisol: feeling overwhelmed, loss of motivation, allergies, decreased sexual interest, poor wound healing, unresponsive hypothyroidism. Now, some causes of low cortisol include poor sleep, where a lot of times people just push themselves to stay up at night doing odds and ends. Dysbiosis, which is really an imbalance in your gut microbiome, where there could be more bad bacteria than good. Toxic exposure, chronic inflammation, chronic pain, depression, long-term stress, because initially cortisol rises, but then over a long period of time, cortisol becomes suppressed. Nutritional deficiencies and low blood sugar. So here is your diurnal cortisol showing burnout or low cortisol. So this person here is just, they're not even able to wake up. It's just very difficult for them. They struggle, and they don't really even rise even at noon. I mean, they just stay consistently low throughout the day. And if you look at this curve, it looks almost flattened. And so this person here is struggling to just function throughout the day. So now we're going to quickly discuss a couple of very common cortisol disorders. And the first is Cushing's disease, which was first reported by Dr. Harvey Cushing, who was a neurosurgeon in 1932. It is relatively rare, and it's caused by the body's exposure to too much cortisol, and approximately 10 to 15 people per million per year are affected. And here, the diurnal rhythm of cortisol is not seen. It's usually due to a tumor that encourages improper and constant signaling to release cortisol. Some symptoms: we see weight gain, your appearance changes just because of fat redistribution, and it can go undiagnosed for many years. And studies show that 3 to 5% of poorly controlled diabetics may have Cushing's. And the most common cause of Cushing's is the prolonged use of cortisone containing drugs. So people who are on high doses of steroids like prednisone and over a long period of time for their inflammatory conditions like arthritis or asthma, they tend to develop Cushing's, and it can be fatal if it's not correctly diagnosed or treated. So some common signs and symptoms of Cushing's syndrome: we see the round face or the moon face, and we also see hirsutism, which is excessive hair growth. And you also see easy bruising, abdominal weight gain, stretch marks. And one of the striking features of Cushing's syndrome is the buffalo hump, or the dorsocervical fat pad, which is just an accumulation of fat that's between the shoulder blades. So another cortisol condition is Addison's, and it's mainly due to adrenocortical insufficiency. And some of the causes include autoimmunity, surgical removal of the adrenal glands, infection, and tuberculosis is actually the most common cause worldwide, not as much in the Western world. Chronic corticosteroid therapy will also suppress adrenal function. So some symptoms of Addison's disease: we have weight loss, hyperpigmentation, hypotension, thinning of axillary and pubic hair. We have vitiligo, which is a chronic autoimmune condition that causes patches of skin to lose pigment or color. May have fatigue, lassitude, which is physical and mental exhaustion, malaise, weakness, anorexia, postural dizziness, syncope, GI symptoms of nausea and vomiting, abdominal pain, diarrhea, or constipation. You've got also muscle and joint pains, and rarely, but it can happen, the flexion contractures, and that's basically where you have a bent joint that just can't be straightened. So there's like a loss of joint motion due to structural changes in like muscle, tendons, ligaments, or skin that prevents joint movements. You also have decreased libido and amenorrhea or no cycling. So what is stress? Stress is a physical, mental, or emotional factor that causes tension in the body and or mind. So stress is at play big time right now, especially around the holidays with the hustle and bustle of shopping, cooking, social gatherings, making sure that everything gets done on time, going here, going there, everybody going in so many different directions. We can't settle down mentally, physically, emotionally, and then you throw in the traveling as well. So stress is really anything that creates an imbalance in your body that upsets the homeostasis that needs to be maintained for us to be healthy. Okay, so now we're going to review the stress response, or better known as the HPA axis, which is the hypothalamic, pituitary, and adrenal axis. Now, this is a stressor signal mechanism that begins in the brain. The hypothalamus sends out a hormone that's called corticotropin releasing hormone or factor. And this happens in the paraventricular nucleus of the hypothalamus. And once CRH hits the pituitary, then the pituitary gets the handoff, perceiving that there's a stressor. And so it finishes up the signaling by sending ACTH, which is adrenal corticotropic hormone, from the anterior pituitary here. And it goes down through the portal vein into the adrenal glands. And from there, the adrenal glands get the message with ACTH, and they produce cortisol. And this is your stress response. And the most important thing to remember here is that all cortisol response begins in the brain and not in the adrenal glands. So what are some sources of stress? Absolutely, job pressures, financial stress, your family, social issues. I know everybody's got a to-do list. It gets longer with time. Life events, daily aggravations, societal issues. Okay, so let's go over cortisol and the healthy stress response. When we're stressed, whether it's a real or perceived threat, the hypothalamus, which is part of the HPA axis here, sets off a hormone cascade to get the body ready to respond to the threat via the sympathetic nervous system. And as a part of this response, the adrenal medulla pretty much pumps out epinephrine and norepinephrine for immediate energy. And cortisol is made about 10 minutes later. So cortisol has to be made. It's not like cortisol is stored and in times of stress, it's there and it's being released immediately. Cortisol has to be made. So you've got the adrenal medulla pretty much pumping out your immediate catecholamines, your epinephrine and norepinephrine, and then you've got cortisol being made, and the lag time there is about 10 minutes. So you've got the immediate energy source to be able to get away from the threat, and then the cortisol kind of comes in behind that to maintain that energy so that you can continue to deal with that stressor. So the body kind of goes from the state of relaxing, digesting, healing, which is, of course, orchestrated by the parasympathetic nervous system, to the survival state. And so here you've got fight or flight. So at this point, to meet the great stress-induced demand for epi and cortisol, the body kind of shifts energy and resources away from activities that are not essential to survival, like making hormones or digesting food or growing your hair. Okay, so really none of that matters, if you're kind of running from a white tiger. So once the threat level is diminished, then the demand for emergency levels of hormones kind of settle down. It returns to the parasympathetic state, and it's focused more on body maintenance and upkeep. And this is a normal, healthy response, which allows the body to bounce back to a thriving state after experiencing that acute stress. Okay, now we're going to look at the impaired HPA axis due to chronic stress. So in chronic stress, the body doesn't return to that parasympathetic healing mode. It's like the fight or flight response never turns off. And the body seems to stay stuck in this high alert survival mode. And at first, cortisol demand is high and the adrenals kick into overdrive to produce enough. And see, making more cortisol requires more pregnenolone, and pregnenolone is required to make your other hormones. So as cortisol production ramps up, the synthesis of all these other hormones declines. So it's almost like a protective mechanism that's intended for us to have enough cortisol to survive that stress. But if this goes on too long, it can lead to, of course, deficiencies in other hormones that are made from pregnenolone. And chronic stress creates communication breakdown between the players in the HPA axis. Excess cortisol over a prolonged period of time is very damaging to the body. The HPA axis actually downregulates and just stops sending messages to the adrenals to produce cortisol. So with chronic stress, there is an inflammatory cascade that occurs. So there's been a shift in the inflammatory response from short to long-lived, which can cause a breakdown of immune tolerance, which can lead to major alterations in all tissues and organs, as well as normal cellular physiology, which can increase the risk of diseases. And so the system of chronic inflammation can impair normal immune function, leading to tumor growth, inflammation, pro-inflammatory cytokines, leading to circadian rhythm dysfunction, neuroinflammation, and impaired stress response. And it's a vicious cycle when it becomes chronic. So with this impaired stress response, it leaves you vulnerable to inflammatory diseases, autoimmune conditions, and cancers. And these are some stressors that contribute to chronic HPA axis dysregulation. Of course, perceived stress, your glycemic dysregulation, where you have insulin resistance, high glycemic index meals, low physical activity. Of course, you also have the inflammatory signals, from gut inflammation, cardiovascular disease, allergies, infectious diseases, and circadian disruption. So if you're not sleeping and you're using a lot of caffeine just to keep going, or if you're working shift work, you've got jet lag, and the time changes every year. So all of those contribute to that HPA axis dysregulation. So this is really just a summary of the disruption in HPA axis with acute stress versus chronic stress. So with acute stress, it's just short-term activation of the HPA axis. And of course, cortisol increases, fight or flight is triggered. And of course, cortisol levels kind of return to normal after the stressor is gone. But then you've got the chronic stress where you've got that sustained activation of the HPA axis. Cortisol can't keep up, and the cortisol levels could be too high or too low, which of course contributes to a lot of symptoms and other inflammatory conditions that pop up. So now that we've gone through the stress response and know how damaging it can be, we need some nutritional support to restore that adrenal balance. We're going to start with vitamin A. The active form, retinol, is required to turn cholesterol into pregnenolone needed to make, of course, the other adrenal hormones. The B vitamins are critical, especially B1, B5, and B12 are needed at every stage of the stress response. Vitamin C is needed for the production of cortisol. Iron, Chronic stress can lower stomach acid, which significantly reduces iron absorption. Magnesium helps to modulate all the activities of the stress response, including regulating the release of cortisol. So too much cortisol does deplete magnesium. And zinc stabilizes cortisol levels. So there's other adrenal support that can be used to stabilize the HPA axis, and some of them are adaptogenic herbs. They tend to build the body's resilience to stress and promote a healthy stress response. We're going to start with Relora. And Relora is a plant extract from Magnolia and Philodendron amurans, which helps to reduce nervous tension and irritability, fatigue, nervous eating. It's also found useful in increasing DHEA levels, and it has antidepressant activities. And Relora is incredible for just calming, relaxing, managing that stress internally. There is also another product called Relora Plus, which actually has the combination of the adaptogenic herb and a B complex as well. So it's a beautiful combination of nutrients that you need with the adaptogenic herb. Ashwagandha is grown in India, Pakistan, and Sri Lanka. So it's part of the nightshade family. And the roots of ashwagandha are known to improve resistance to emotional and physical stress. And ashwagandha is also very good for brain activity. So a lot of the people who use ashwagandha, it doesn't just lower or balance their cortisol levels, but it improves brain functioning, and it reduces inflammation as well. Holy basil optimizes cortisol levels when altered by stress, and it lowers blood sugar in type 2 diabetes. It does help to improve memory by increasing blood circulation in the brain. Rhodiola is an energy boosting powerhouse, so it helps to relieve fatigue, promotes positive mood. It improves sleep and brain function. RG3 or Panax ginseng, it is one of the 40 ginsenosides, and it supports healthy neurotransmitter functioning in the brain. It decreases microglia activation and neuronal cell apoptosis in neurodegeneration conditions like Parkinson's disease and Alzheimer's. And theanine is amazing. It's not an adaptogen, but it is very beneficial in reducing anxiety by promoting increased GABA response, increased dopamine, and it improves mental awareness. It also reduces norepinephrine levels and decreases blood pressure. And I use a lot of theanine, and theanine is very, very benign. There is no ceiling dose with theanine, and theanine can actually be used with the other adaptogenic herbs as you see fit. And that's really the one that can be tweaked, and you can increase the dose or decrease the dose as you see fit in conjunction with these other adaptogenic herbs. So some lifestyle changes for lowering chronic stress. It's good to say no. A lot of times we are yes people because we want to please, especially us women, just because we tend to be the caretakers in the family. And we just feel obligated. We have to do everything and feel guilty about saying no. But we have to learn how to manage our time. Sometimes saying no is a lot healthier than just continuing to do and increase our to-do list. It can be too much. So saying no can be good. Just let go of what you can't control. We cannot control the weather, so just don't worry about it. Getting adequate rest and sleep. And if napping is something you need to do, take a nap. If your body's telling you you're tired, take a nap. Resting is so important for the body to be able to maintain homeostasis. Hydrate with water as often as your body needs. Your body needs fuel. It needs hydration. We need to hydrate with water as often as your body needs. So some more lifestyle changes for lowering chronic stress. We do need to adopt a more nutritious diet, including green leafy vegetables and organic meats, more wild caught fish. We got to give it good fuel so that our engine can work better. Cut out processed foods, limit sugar, like your high fructose corn syrup and high carbohydrate meals. That just slows our bodies down. Cut back on your phone, computer use, watching too much TV, especially with all of the bad news that's coming in, whether it's local or worldwide. There's so much stress there just knowing about all the bad things that are going on in the world. Incorporate meditation and breathing exercises and gentle exercise like yoga and Pilates, Qigong, Tai Chi, and even walking, just walking, not even briskly, and stretching exercises are all good in helping us maintain lower stress. So ultimately, it's all about balance. So too much cortisol due to chronic stress creates inflammation, chronic diseases, and a poor quality of life. So we all need to learn in our unique way to shut constant stimuli off to allow our bodies to regain homeostasis, hence a more healthy, thriving body. Thank you for joining us today, and I hope that the information was helpful. And please join us for our next webinar.